Hi everybody, this is Kia Sanford. I'm a clinical nutritionist and counselor, and I decided for a change, rather than do my regular written blog, I would do a video blog because I'm experiencing something personal that I think might actually have benefit for everybody else to see too. Turns out, lucky me, I have managed to kind of mess up my left shoulder doing yoga inappropriately, and highly encourage you to get really good instruction when you do yoga because it is dangerous, even though it looks like it's fairly easy. It's not. At any rate, I have a tear that's on both sides of my shoulder, in the front and in the back. It's called a slap tear, which involves the biceps muscle, and I'm going to have that repaired next Tuesday. So it is now a week prior to surgery. I go in this afternoon for my pre-op meeting with the physician's assistant to go over all of the procedures and make sure everybody's on board. And one of the things that I'm definitely going to do is take in my 23andMe test results. For those of you who don't know what that is a genetic test that looks at gene SNPs that leave you vulnerable in certain areas. One of the areas that I'm looking at is my detoxification system. And there are a couple of SNPs that I possess, again, lucky me, that set me up to be very sensitive to certain medications because it makes it so that my body doesn't create enough enzymes to break them down. So I want to be sure that the whole staff is very aware, and in fact I think what I'm going to do is write no Demerol across my forehead upside down so that the anesthesiologist who'll be sitting here will remember. At any rate, so there are things like that that we need to go over. So that'll be something we do today, as well as any other procedures that need to take place prior to going under. One of the things that I decided I would talk a little bit about are what am I doing to prepare myself nutritionally, and what am I doing to prepare myself just kind of thinking ahead about what are those first 48 to 72 hours going to be like here. I live alone. Happily, I have a fabulous support network. But those first few days are going to be tough. So making sure that I've got everything kind of that I need right at my fingertips is going to be very important. There are a few things that I'm going to suggest, particularly if you're anticipating any kind of shoulder surgery or surgery to an arm that leaves you one-handed, is to make sure you set yourself up for one-handedness. Try this. Try an experiment of living one of your days pre-surgery with one hand essentially in your pocket, so you can't use it, and see what sorts of stumbling blocks you come across and how you can help yourself fix those. One of the things that occurred to me is I am not going to be able to get shirts up over my head. So I'm going to need to have things with zippers. I'm going to need to have things that have buttons in the front, super loose things that I can pull over and just get one arm through for those first couple of days, because I'm going to have big bulky bandages and a big sling. And that's essentially my first week until they get those first layer of bandages off. So things that you wouldn't necessarily really think about, you got to kind of work your way through, and that's why I say spend a day with a hand in your pocket. Then you'll know where your stumbling blocks are. The other thing I'm going to do is really get myself set up nutritionally. So I've already started that program. I'm really loading up on antioxidants right now, and I'm not saying I'm loading up on a whole bunch of pills. What I mean, and if you've worked with me before you know this, is that I always start with food first. Food is the language that your body really understands the best. And so that's its best delivery system whenever you need to load up on things. So I'm having lots of fruit, I'm having lots of vegetables, I'm not drinking juice. And the reason for that is that juice tends to be very high in sugar. But I will do a smoothie. Now smoothies, the way that I build them, have a healthy fat, a lean protein, really high quality protein, and then low glycemic carbohydrates with just a little bit of fruit to really sweeten the pot, essentially. So I'm using the fruit as my sweetener. So I'm not just having a fruit smoothie, which is all fruit and nothing to slow the sugar down. So what I'm using right now is a really high quality whey protein that is a concentrate, not an isolate, but a concentrate that is non-GMO. It's all grass-fed animals. It's organic. So I know that there's a high quality protein. It's undenatured, meaning it hasn't been broken apart in funny little puzzle pieces. Your body is left to be able to do that. So whey, the reason I've chosen that, I just want to give you a little snippet there. Whey is one of those few things that we know of in the field of nutrition that really helps to stimulate bone marrow. Now, bone marrow is where all of your blood cells are made, your red blood cells and your white blood cells. So when you're looking at a potential for an immune system emergency, basically, is what that accident, or what a surgery is, which is sort of an on-purpose accident, so that all of your white blood cells need to be in tip-top shape so they can rush to the site and do their job cleaning up from any bad bugs that managed to get in during surgery, as well as helping that area to get inflamed. You need some inflammation that's healthy, but also get itself uninflamed. You need that system to be working really well on both sides. So in addition to the whey powder, the other thing that I'm really helping my body by taking is some fish oil. Now I'm not going to take that, today's the last day I'm going to take that. I've been taking it up until today because they want you to stop taking anything that's going to start potentially thinning your blood about a week prior to surgery. Things that are going to do that are fish oil, garlic, especially if you're taking a garlic supplement. Vitamin E will also do that. So those are three things right off the top of my head that I can think of that we're going to definitely take out of the regimen prior to surgery in this week. I don't want to bleed out on the table. That would be bad. So I'm going to do other things like really supporting those aqueous or water-based antioxidants, and those are going to be your B vitamins, vitamin C, different sorts of bioflavonoids that I can get in there as well. So the things that are going to be best carriers for that are going to be your fruit and highly colored vegetables. So, bright red bell peppers are fabulous. Bright orange carrots. And, honestly, the only bright orange carrots I've ever really seen are the organic ones. Yeah, the other ones actually taste like carrots too. Other great brightly colored things like apricots, fabulous. The other thing that I'm doing is I'm setting myself up for post-surgery so that I have some of those things directly available to me. So in the couple days before surgery, I'm going to go and do a big grocery shop. I'm going to get things all set up. I'm going to have things cut up in my refrigerator so they're easy to grab. I'm probably even going to set up a cooler next to my bed, which will have some of those things in it. I've also got some dried fruits, because one of the things that tends to happen post-surgery is they'll give you different sorts of pain medications, and a lot of those pain medications really have a tendency to create constipation issues. And that, coupled up with lack of movement, which is also one of your body's ways to stimulate defecation, is to really you have to move that body through space. When I'm lying in bed and taking a pain medication, those are two things that are really going to have a tendency to get me stopped up. So I'm going to try to prevent that with making sure I have plenty of fiber. I'm going to have some dried fruits, like I said. I'm also going to add in some probiotics. Now, probiotics, for anybody who hasn't tried them for constipation, are something that it's kind of counterintuitive. You don't necessarily think, well, that's going to be something that solves my constipation. But it actually really, really helps, because you give those critters a home, and they provide a service by helping to break down and keep the stool kind of light and fluffy. You want that stool not to get just hard and dense. That's when it really becomes a problem. So the third thing that I'm really going to be adding a lot of in this week is water. I try to do a really good job of that normally. I should be better. I know better. I'm the nutritionist. I should know these things, but I'm really trying to make sure I have a bottle of water with me all the time, and I keep refilling it and keep drinking and just sip it across the whole day, and then occasionally do the glug, 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 so that I do get both types of water intake, one that flushes the system, which is the glug, glug, and the other, which is the sip, sip, that continually hydrates and gives the body enough time to absorb that water back into the system, or into the system from the GI tract. So those are some key things that I'm going to be working on in the next couple of days. I'll check back in after I have my pre-op appointment in a few hours, and I'll post as I go. And hopefully you will see me pretty regularly over the next couple weeks as the procedure goes on. Take care.